It's Nick the nurse here. Today we're going to be talking about the nursing problem of hypothyroidism and some of the nursing interventions that you need to be familiar with on nursing school exams and if they come up on the NCLEX. So with hypothyroidism, you need to make sure that you provide a warm environment for your patient as they might be cold, right? Administer Synthroid or levothyroxine as ordered. Generally, this drug should be given when? In the morning or at night? In the morning, because it might keep the patient up all night because it's going to increase their metabolism. Same reason you don't give cups of coffee to people at night. For some people it works. I know that's the exception and it does work for some people, but generally rule of thumb is we don't want to do that. We want to monitor for signs of thyroid drug overdose, which include tachycardia, palpitations, weight loss, chest pain, muscle fatigue, and restlessness. We want to teach the patient to follow a high bulk, low calorie, low fat diet. Exercise should also be encouraged in this patient to kind of get their metabolism going. We also want to assess for and prevent constipation in the patient. If constipation develops, a stool softener may be prescribed and you'll give that as ordered. Patients who have hypothyroidism may be sensitive to opioid analgesics and sedatives, so they should be avoided or their doses lowered as ordered. Avoid giving the patient sedatives because the patient might already be fatigued and lethargic. We want to monitor the patient's neurostatus, provide for frequent rest periods because they're going to be fatigued or lethargic. We want to provide excellent skin care and hygiene, right? Monitor for signs of myxedema coma. Now, this often comes up on nursing school exams and might even come up on the NCLEX, so you've got to make sure that you understand myxedema coma. Now, signs of myxedema coma include hypothermia, hypoventilation, bradycardia, hypotension, cerebral hypoxia, decreased cardiac output, respiratory depression, generalized edema, hypoglycemia, hyponatremia, stupor, coma, and unfortunately death. So you have to make sure that you understand those signs and symptoms. Now, the interventions for myxedema coma are equally important to understand and comprehend and cognitively be able to demonstrate on your exam. Now, these include maintaining a patent airway, administering Synthroid, glucose, IV fluids, corticosteroids, and monitoring for and preventing aspiration. We want to make sure we keep a good airway and that the patient doesn't aspirate on any fluids or food or anything like that. And we also want to make sure that we keep the patient warm, right? So it's kind of, I think of myxedema coma kind of as a, when you're looking at polar opposites, again with endocrine disorders, I think of thyroid storm on one side, that's the hyper, and I think of myxedema coma on the other side. We want to make sure that we're able to differentiate between the two. Okay, they're kind of the extremes, and if that helps you remember it, then more power to you. Again, my name's Nick the nurse. I'd like to thank you for watching my video today. If you'd like to check out any of my other completely free videos, you can check them out at www.nickthenurse.com, or you can check out my YouTube video channel at Nick the Nurse. Thanks for watching. I'll see you next time.